So I'm part of a large research team that is also part of a large collaborative study. And so by taking all the evidence as a whole, we're trying to do our best to conduct robust analyses to try to answer some of these important clinical questions. So for example, more recently, we're looking at oral contraceptive use and how this might impact breast cancer risk. One paper that I spoke about today was Tamoxifen, and that is the only drug that's currently approved for chemoprevention in BRCA mutation carriers. Use of this drug for chemoprevention is quite low. I'm not sure if women will ever start increasing their use of this drug, but in our analysis, we saw a protective effect, but this was not significant. So this is likely going to play an important role when clinicians are interpreting the evidence specifically in mutation carriers. We are seeing an increased risk with oral contraceptive use, but what we haven't answered yet is whether the risk increase of breast cancer risk goes away after a woman stops using, because in the general population, although oral contraceptives will temporarily increase her risk, the association goes away after a woman stops using contraceptives. And we know oral contraceptives are important for women at a young age, and it has several important indications. And so we don't want to cause any fear in high-risk populations. We've also looked at the impact of hormone replacement therapy. It's very important to mitigate adverse effects of early surgical menopause in this population. They have their ovaries removed at a very young age. So we are preventing disease and impacting overall survival, but we don't want these women to be having a horrible quality of life, developing osteoporosis or any cardiovascular events. So we need to find a safe way to use HRT after oophorectomy. And this is important for clinicians too, because clinicians taking care of these women have to know what is appropriate to use to manage some of these non-cancer outcomes, and hormones play an important role in that.